Hello everyone, welcome to our webinar series, Shakti here the side. As we know, monsoon fevers are on the rise and we are here to discuss about typhoid fever. And for this discussion, I like to call and welcome Dr. Himabindu ma'am, who is our senior consultant physician, Yashoda Hospitals, Somachigoda unit. I welcome you, ma'am. And we do have speakers from Government General Nizam Hospital, Ms. Priya Darshini, and Ms. Navya Shri, who is the nurse manager from Yashoda Hospital, Secondabad unit. I welcome you all.
Thank you.
And we are just going to keep this session very time bound and let us see what we have in today's session. Yes, over to you, Priya.
Yeah, a very good afternoon, ma'am. Thank you so much for your time. And as we are going into the topic, typhoid and enteric fever, what exactly it is, and can you please give us an insight? Because as it is, it's an bacterial infection, and it's mostly contaminated with having with eating and drinking of contaminated foods. Can you please give us more insights over it, ma'am? Because as it's monsoon, so the incidence is more raising. So please, over to you, ma'am.
Yes, ma'am. Dr. Ma'am.
Hello. Yeah, thank you for this opportunity. So as you have said, typhoid fever is on the rise and it is mostly spread through fecal-oral route. That is, whenever you eat this contaminated food or contaminated water, that is how you contract this typhoid fever. And another mode of spread is there is no direct person to person, but it spreads indirectly. That is when a patient passes stool in a toilet. Like suppose this salmonella bacteria, it gets excreted in the stool. So if it is not in unhygienic conditions, if the bacteria is persisting in the toilet and when another patient uses it, that is how you contract the infection. And another one, if you're not maintaining a hand hygiene, suppose you're eating on a bandi side,
Yes.
roadside bandi, suppose his hand,
Yes.
doesn't wash his hands properly. So that is when you directly, the food and water will be contaminated and you should be very, very careful whenever you are eating outside.
Yes, yes. Yes, very productively you have provided the information that sanitation measures also to be, taken care as well. Yes. Yes, over to
Yes.
you. We have Navya. Yes, over
Good
to you.
afternoon, ma'am. Myself, Naveshri, working as a nurse manager in Yashoda Hospital. So, as we discussed about the cause of typhoid fever, so we are presenting with the symptoms like high fever, headache and fatigue, abdominal pain, diarrhea and constipation, loss of appetite, and dry cough, like rose spots rash, and red flag symptoms like high fever that starts low and increase daily, possibly reaching as high. So, is there any other complications we can see, like symptoms which present like red flag symptoms for the patient, as dengue and malaria, or also fever which present for the patient? Like initially, fever and headache is the common symptoms for both the fevers, ma'am. Over to you,
Yes.
ma'am.
So initially in the first week, it is a little bit difficult to differentiate between the common fevers because all
Yeah.
malaria, dengue, they all present with high fevers. And usually they also are associated with headache and abdominal pain. But usually typhoid pattern is a step ladder pattern. That is slowly it will start and it will peak. And usually in clinical examination wise, your pulse rate will be slower than the temperature you appear to have. So that is one thing in the first week. In the second week, the number of complications will increase. That is your abdominal symptoms like constipation, diarrhea will be much more. Vomitings may be there. Then headache can lead to confusion, leading to encephalopathy. And even gastric problem, there will be certain ulcers which are forming in the small intestine, which can lead to perforation,
As well.
which can lead to internal bleeding. So these are some of the complications which you expect in the second week. And another way to find out is the rose spots. Rose spots are some spots which are found, erythematous spots which are found on the trunk. Usually they last for 3 to 4 days and they're not very classical. We don't find in many patients, but it is mainly when the fever is lasting more than 1 week, the suspicion of enteric fever, especially in the particular season and the particular environment in which the patient is, you can suspect typhoid fever.
Yes. And,
And usually complications, if you leave it untreated, suppose it goes on to third week, then major complications will rise, like encephalopathy, patient can have confusion, then internal hemorrhage, which can lead to shock, then myocarditis, that is inflammation of the heart, which can lead to breathing difficulty, then cough may increase.
Yes.
So these are some of the complications we expect in typhoid.
Yes. And I just wanted to understand that what is the total intubation period, ma'am? Like incubation period
Yeah.
Incubation
once the
period will be
lab
2 to 3 weeks. Suppose you have been exposed to a particular patient or particular food. It will grow slowly. That is, it won't directly go into the blood. The concept of why it is
Yeah.
2 to 3 weeks is the bacteria first enters into a small intestinal epithelium. From there, it will go into the Peyer's patches. That is, these are small lymph node patches which are present in the small intestine. There, they will multiply. Then they will be taken over by the spleen. There, they will multiply. So, in all the lymph node areas, mesenteric lymph nodes. So, this is where they will multiply and then join the bloodstream. That is when the infections will start. So, that is why incubation period will be 2 to 3 weeks, not like food poisoning within 1 or 2 days you will manifest.
Yes. Yes.
Yeah, it takes time, and more of ma'am wanted to understand like more. It will be presented with fever and more of gastrointestinal symptoms. You will say,
Yes.
unlike other fevers. Yeah. Yes, ma'am.
Yes. Yeah, Priya, this is your discussion.
Yeah, ma'am.
Diagnosis.
Coming to the most important, like the diagnostic part, like with the basic CBPs and Vidal test, we'll be able to diagnose the fever. And initially, like usually, directly after seeing the patient clinically, you suggest Vidal test, or like with the CBP also, we can make any differences. Like, can you please give us more insights on this, ma'am?
Yeah, sure.
The rising
Actually,
of
when it presents, when it presents in the first week or first 4 or 5 days, it is very difficult to differentiate between other fevers. And CBP usually will be normal, but in some patients, at least 30 to 40% of patients will be able to see leukopenia. That is, WBC will be less. But that is the same presentation even for dengue. So when they present in the first 3 4 days, it will be difficult, and Vidal and Salmonella IgM will not come positive till seventh day of illness. It is waste sending Salmonella IgM and Vidal in the first 3 4 days. It is the blood culture actually. If you are very suspicious, if the patient is looking very sick and he has predominant gastrointestinal disturbances and he's from an endemic area of typhoid or he has traveled somewhere, then
that
better
is
to send this blood culture. Blood culture will pick up in the early days. Bone marrow culture also will diagnose, but it is too aggressive to do in the first 3 days. So that's why we can send blood culture and always rule out dengue. Dengue NS1, if we send in the first 3 days, it is easy to rule out because dengue NS1 is very reliable. Typhoid, it's always definitely difficult to pick up because blood culture is also only 40 to 50% will be positive. Remaining 50% we can't pick up. That is when the disease progresses beyond seventh day. Then we will start off with Vidal and Salmonella IgM IgG. That is called Typhi dot. They will detect the antibodies to the surface antigen. So if IgM is positive, then you can easily start off the regimen.
Yes.
Yes. Perfect.
Yeah, that was a very interesting. As you said, that it is unlikely, very difficult to diagnose between the dengue and typhoid. Yes.
So,
Now this is the important slide, which is nothing but your treatment and care of typhoid. Yes. Over to you, Navya.
So, as patient is diagnosed with the typhoid fever, so we go with the treatment and care based on the patient affected. So, assessment is like frequent monitoring of vitals, including temperature, as it increases from low to high. So, it is mandatory to assess the fever spikes. It is low from higher, whether it is increasing or not. IV fluids, if dehydrated, weak, or not able to take orally, like monitoring hemodynamically stability, like especially blood pressure monitoring whether hypotension or hypertension was present for the patient. It is mandatory to monitor blood pressure. So to prevent shock, we have to start with IV fluids and careful monitoring of input and output charting. So whether intake is maintained for the patient or output is improved or not. So medications are prescribed, especially administering of on-time IV antibiotics. Light, easily digestible diet to be provided for the patient. Avoid raw food items. Symptomatic treatment for patient like fever, vomitings, etc. we have to be provided for the patient. Ma'am, any other complications will be occurred for the patient if early stopping of antibiotics, ma'am? Over to you, ma'am.
or any other care when you visit
Hmm.
your patients, so
Yes.
bedside nurses
So,
should adhere to.
Yes,
Yes.
ma'am.
yes, from the nurse's side, I think you have covered fluids are being given, BP should be monitored. And one other thing is hand hygiene is important. As you
Yes, ma'am.
always stress in
Yeah.
infection control, hand hygiene is very important. Always sanitize your hands before giving the IV this thing. Because that's a way they'll be very sensitive, and because as it is, their immunity will be low, they will contract infections. So following hand hygiene is important. Next, you're giving, as you have said, paracetamol and antibiotics and IV fluids is appropriate. Then one more thing you should watch for is patient if he's going into any confusion. And the first one to notice will be sisters, like what is he speaking, why is he speaking like that. So if any confusion,
Yeah.
if any brain involvement is very important, especially in the second week of fever. Because if encephalopathy is there, we have to give steroids. And another one is typhoid. Treating typhoid is very difficult. Just 4 or 5 days of oral antibiotic is not going to help. You actually, the IV ceftriaxone or cefixime is the only thing which is going to work. Before there were ampicillin, chloramphenicol, Septran, Cifran, but these are not working anymore. So it has become multi-drug resistant. So ceftriaxone for 14 days is important. If still it is not working, we go on to meropenem and azithromycin. If we don't give these in third week, they'll end up in multiple complications.
So now this is the preventing part. Yes, Priya, and we are just nearing to the end of the
Yeah.
discussion. Yes.
Yes, like as we all know that prevention is better than cure. Like the practices which we do, like good hygiene and safe food, and drink only clean and filtered, purified water, and maintaining good hygiene and prefer freshly cooked food uh, uh, and avoiding junk and foods prepared unhygienically. A part of this, ma'am, like vaccination, coming to the vaccination role of like vaccine, ma'am, for because as in the regular vaccination schedule, typhoid vaccine has been included, and only the children and travelers and the elderly people are advised, or any person can take this. And we really need a prescription for this to for a person to take this vaccination, madam, because in monsoons, like if we are really concerned, like how far this vaccine will help us, and what are the indications, and just to prevent it, how can we approach a consultant regarding this?
Hmm. So usually it is included in the UIP schedule also, and it's not compulsory, it's not
Okay.
mandatory,
It's an
but it
option.
is highly
Ah,
suggestible vaccine, especially for children because they tend to eat outside and their immunity is low and immediately they get affected. So about 2 years, we
yes.
can give this TCV conjugate vaccine. Up to 45 years is what they suggest. And because the
Ah,
frequency of eating outside will be more in this age group. And above 45 years, if they have any risk factors like diabetes or heart disease, or then if they have any liver disease, or they are frequently traveling to some endemic areas like Africa, or even in India, if they're going some village side where sanitation is not expected to be good, such
Yes.
people who are going to be, and people who eat roadside, and better to avoid roadside food because vaccination is not
yeah.
100% effective, it is only 70% effective.
Yes.
So
Yes.
always prevention is better than cure, but children, because they are they don't have immunity, it's always better to vaccinate them. And
Yes.
usually it lasts only for 3 years. Booster doses, if required, you should take after 3 years. So that is why only some people, that is people who are at risk, especially traveling, and people who are eating roadside, it's worth taking the vaccine.
Vaccine. Yes, I think yes, and yeah, as a we take a pledge for independence from all diseases, as this slide shows also, and this is the pledge for the
Yes, definitely.
Independence Day.
Because
Yes,
apart from vaccination, our hygiene is the most important thing which will
most
prevent
important thing.
typhoid.
Yes. Yes.
Definitely, we should
Yes.
all take pledge not to eat roadside food and
Yes,
eat freshly cooked, drink boiled water, avoid
yes,
raw food,
Yes.
yes.
Yes. Yes. Yes.
maintain good oral and hand hygiene, both.
Hand hygiene, yes. And yeah, I request all the viewers to just refer www.yashodahospitals.com website for more academics, health updates, and patient testimonials for evidence-based learning. And I urge you all to just share this link for more awareness and share. Yes, we end the session. Thank you, Bindu
Thank you,
ma'am.
ma'am.
Thank you, Navya, and thank you, Priya.
Thank you, ma'am.